Tashi Raftan is from Leh in Ladakh. He is an Amchi, a Tibetan doctor. Every year he travels down to the Spiti Valley. It is a 3-day journey to work in the town of Kaza, where a friendly family vacates a room in their house for him to stay and see his patients. Everybody sits on the floor of that simple room. Tashi Amchi starts the examination of his female patient in the typical Tibetan way. First, visual diagnosis. Second, diagnosis by touch, which incorporates pulse diagnosis. And third, diagnosis by interrogation. This third step, interrogation, is crucial as he has no medical history of any of his patients. Tashi Amchi, however, knows this woman from earlier visits. The urine diagnosis was skipped. It is part of the visual method, but it is not often used in this kind of environment these days. The woman complains about a pain in her upper back. Tashi Amchi believes her blood pressure is too high and inquires about her monthly discharge and what color it might have. It is dark. Well, almost black, she says. And Tashi Amchi feels that is the problem. The color of the discharge is linked to the pain in her back. The medicine, in the form of pills, is carefully counted and handed over to the patient in small paper envelopes. Ladakhi Amchis travel throughout the year to many places, so they carry their medicine with them in small pouches of different colors and sizes. This small room is the scene of constant comings and goings. People are treated in groups. There is no privacy whatsoever. In addition to paper, small plastic bags have come into fashion lately for packing away the Tibetan herbal pills called rilbus. Tashi prepares some of the pills himself. He has to buy most of them from other sources, so payment becomes important. But he would never ask for it. According to the established code of conduct and the idea of the medicine Buddha, which is comparable to the Hippocratic Oath, the amount of money given is up to the patient. Pulse reading is a great art, and it is the main feature of the Tibetan method of diagnosis by touch. The physician places his index, middle, and ring finger in a straight line on the right or left radial artery of the person. Different pressures are applied at different times, and the pulse is felt at different regions on the tips of the 3 fingers, resulting in the reading of one of the major pulses, the constitutional pulse, corresponding to the 3 humors in Tibetan medicine. There is a specific male pulse corresponding to the wind humor called lung. There is a specific female pulse corresponding to bile or tripa. And there is a bodhisattva pulse or neutral pulse corresponding to phlegm or badkan. The 3 humors and the 5 elements are linked to each other, and each and every person carries a specific mix. And even within the body, these energies and elements are individually mixed. The same applies to the rilbus, the pills. They also represent a certain mix, and they are given to strengthen or reduce certain elements or functions in the body of the patient. Usually they are swallowed with some water, at sunrise, at noon, or at night. Tashi Amchi also carries a small supply of the expensive and precious Rinchen-rilbus, or jewel pills. They are the most potent pharmaceuticals in Tibetan medicine. Their components are known, but the manufacturing process remains a trade secret. Covered by silk in different colors to indicate the kind, Tashi gives it to the woman with the stomach pain. Apparently, he decided on a more potent medication. Jewel pills contain not only herbs, but up to 100 different components, including precious stones and metals in a detoxified form. Soon, these bags of medicine will be packed, and Tashi will be on the move again. But sitting on the floor and sharing a room with a Himalayan doctor is so immensely different from the everyday reality in the West.